Hi everyone, I am Dr. Himani Joshi and today I am fortunate to have with me Dr. Gunita Singh. Welcome to the studio, Dr. Gunita.
Thank you, Himani. Such a pleasure to be here. Such a pleasure.
So Dr. Gunita is the course director with the Academy of Dental Excellence, Vasant Kunj, Delhi, Vasant Vihar, Delhi. And together DBMCI and ADE have joined hands to start the clinical education program. Okay, so just a little brief about CEP, ma'am. What is CEP exactly?
So the Academy of Dental Excellence is running these clinical educational programs now since 2000. So it's been almost 24 years that we've been training young graduates to come and do dentistry themselves on the patients clinically. So what's happening over the period of years, Himani, is that the exposure to the patient in the graduate scenario is becoming low day by day.
Very
so when a student becomes a doctor and he enters the world, he feels completely zoned out that, how am I supposed to build up a contact with the patient?
Correct.
How am I supposed to talk to the patient?
Correct.
How am I supposed to diagnose the case? And then how am I supposed to perform a specialized procedure?
Correct.
So they're just lost, and what they're doing is that they're running from pillar to post, from one senior to another, that please let us assist.
Correct.
Dear doctors, you are all now BDS with a degree of a doctor. You are not supposed to assist. You're supposed to work on a patient.
Perform
so
the
here
case.
comes us here to help you. Come and perform in the academy on the patients yourself. Having said that, I respect you as well as the patient. He's not a guinea pig. So there will be mentors, there will be surgeons, there will be specialists sitting there, standing on your head, guiding you through and through every step so that you don't make a mistake, the patient is safe, and you build confidence to utmost level.
So this is more about the practical aspects of dentistry, unlike just the theory that you know how to do a root canal on paper. But this is about the practical aspects, actually performing every step of every procedure hands-on on the patients under the guidance of senior mentors who will be guiding you at every step. So it is basically bridging that gap between theory and practical.
Absolutely, Himani. When a student walks in, we like to give one or two theory lectures, because we want to brief them a little bit before we start working
practically,
on the patient.
Yes, very true.
This is my experience of 20 years that on the third theory class, the student just loses patience completely. That when will we get a patient? They are so hungry to work.
Very true.
This is a totally clinical program. We understand your apprehension. We are just giving you one or two theory classes to get on a level with us, to understand us, and we should understand you. But basically, by and large, it's a 90% clinical program.
Clinical program. I think just a 20 minutes theory discussion followed by a daily hands-on that is there every day. I've seen the center. It's a beautiful setup. Multiple chairs, a left-handed chair, mentors from every aspect of clinical dentistry sitting there just to guide you, and no dearth of patience. I mean, depends on your speed. If you are fast in performing procedures, if you're a quick learner, you can perform even more than a patient every day. If you're a slow learner, it's okay. You begin slowly and then you learn how to, proceed in a very methodical yet a quick manner. So that's about the course, that's about the program. And within the program, we have different courses running, starting with the most popular course. I think the clinical dentistry program, ma'am, is the most popular course.
Clinical dentistry is definitely the most popular course.
Yeah.
But then, when a student walks into the academy and he wants to know everything about dentistry, then clinical dentistry definitely is the best option for you, because starting from diagnosing the case to doing root canals or extractions or giving a bridge after extraction or doing a cap after root canal, everything is taken care of. But if somebody wants to do a specialized thing, either they can join a specialized course, or we also have the options of top up. You've joined the clinical dentistry and during the procedure during the whole course you feel that, endo is really fascinating me, I want to learn more about endo, you can keep topping up your courses also. So
Correct.
that option is definitely there. But for young graduates who just passed out, Himani is absolutely right. Clinical dentistry is the answer.
The most popular course, because what happens usually is आप college जाते हो and college में you are given a case. You are given, okay, this patient needs a class 2 restoration or this patient needs an extraction. In this course, you sit and diagnose the case. You talk to the patient communication is built. You talk to the patient, you understand his complaints, you make a treatment plan on yourselves, you discuss the plan with your mentors, you take radiographs, you discuss the plan with the patient that this is what is going to be done with you, and then you execute the plan under proper supervision. And that is exactly where you gain confidence. That tomorrow when you start your own clinic, when you have your own setup, there won't be any teacher to tell you that this should be done or that should be done.
Absolutely.
It is you who will make the decision to what case should be performed and how to go about it.
I would also like to add when Himani says that it is who has to make a decision.
Yeah.
Similarly, like other academies, we don't convince you for doing general dentistry. If you have walked up to us and you say, no, I want to do oral surgery, that's my dream, that's what I want to do, fair enough. We have beautiful individual courses also.
Yes.
We are not convincing you to join one particular course. We are there to help you and pursue your dream. If your dream is endo, we are there to teach you endo. So, it's your choice completely. You have to make a decision.
Correct. So you may feel that, okay, I have done a little bit of RCTs here and there, but it is the extractions that I'm not very confident at. So you have the particular short and long-term courses. So ma'am, what is this general dentistry course? Let's start with talking about general dentistry course first. So is it a long-term course or a short-term course?
So, we have designed them according to the classes, Himani.
Okay.
I appreciate and understand that every person who's walking into, every candidate who's walking into the academy is a doctor. And I respect their individuality and their time. If you walk into me and say that I have only 10 days, ma'am, fair enough, darling. You have only 10 days. We are going to give you what you want in 10 days. So we have not programmed them in long term or short term. It is according to the classes. If the general dentistry course says 50 to 60 classes, it's on the website, whatever the number is, and you say that we want to finish it in 1 month, fair enough. We will do 2 classes a day. Morning we can do endo, evening we can do oral surgery or prostho or perio, whatever the schedule says. You can do 1 class in the morning, we can have a lunch break, and then the another class in the evening. We can finish it as quickly as 30 days. In 1 month, your entire clinical dentistry will be done, and believe me, there will be no compromises. I promise you on that, right? Number 2, if you say that I am a clinician, I work from Monday to Friday, my only chutti is Saturday, Sunday. Fair enough. We will design your course in a way that you will be having classes only on Saturday and Sunday. And similarly, how much ever time it takes to finish your course, we are there to help you. So we are very flexible. See, it's not about, just having you and just increasing numbers. It's about satisfaction, 100% satisfaction. So we are very flexible with the durations.
So the timings are customizable, the duration of the course is customizable with a definite deadline that yes, within 3 months you will have to finish the course. I mean, you cannot take days to finish it, but yes, it is definitely, it can be modulated according to your schedules, according to your practical timings. All right, so usually, ma'am, students have this query कि कितने patients करने को मिलेंगे? How many patients will we get for every procedure? Like, so for example, how many extractions or how many surgical extractions, how many RCTs are they expected to learn in the general dentistry course?
Well, this is a very, very valid question. She's absolutely right. Most of the students who are walking in, they have only this stress, कि how many patients we'll get. So I'll give you a double answer for this, a dual answer. Number 1, please don't worry. If you do 1 root canal properly and you're doing a single sitting root canal, that is more beneficial than making 4 mistakes in 4 different root canals, right? So please don't worry and think that I'll do very quickly so that I get more patients. There's no dearth of patients in the academy. They're actually waiting. So many times I have to, on a Sunday, I have to call all my staff to come and complete the cases because I don't want those poor people to keep waiting and thinking that only because we are not paying, we are just standing in the queue here. So there are empty number of patients, don't worry about that. Depending upon your speed, we keep giving you patients. Every class that you enter the academy means a patient. So if you enrolled a course which has 55 classes, it means 55 patients.
Yeah.
Having said that, somebody ends up doing 65, somebody ends up doing 45, depending upon their speed. But it is okay. If you have done less than the patients you expected, we will call you on a Sunday and cover up for you. So don't be in a hurry, speed up, make mistakes only for the sake of increasing the numbers. Numbers are not important. But if it is important for you, then it is important for us also. We'll call you on the weekend and cover up for you. But go slow, learn well. That is important.
Very important point that ma'am has said. Learning is what you need, not a quota to finish. It's just a learning experience that you need, and just be assured that it'll be a great learning experience. You can just go to the website, read the reviews, and students are really, really happy. So
I'd like to just add on one thing to this, that there had been a case or two in our academy where 10 classes were over or 15 classes were over, but a student had done only 5 cases till then, or maybe 6 cases. So we had stopped her classes in terms of counting the classes, and we made sure that she does 3, 4, 5 cases independently, with patients, so that she doesn't get hyper that mere case, I'm not able to
classes
complete the cases. So we are there to help you. Yeah. I am sitting there all the time to help you. So you might have difficulties, you might have problems. None of us are perfect, but we make sure that we rectify those problems for you. We help you further, so that for us, for both of us, for DBMCI and for our academy, now we are at a position where reputation is more important than anything else. So don't worry, we will not play with our own reputation.
I'm sure you won't, ma'am.
Yeah.
So, what are the procedures that will be included? So when a student enrolls, that I am enrolling into the clinical dentistry course.
Okay.
So when I finish my 55 classes, what all are the individual things that I'm learning from the clinical dentistry course?
So our clinical dentistry comprises of starting with oral medicine and radiology. There are 5 classes for oral medicine and radiology, where they will just see a patient, observe them, take x-rays, understand the angulation, understand how to take x-rays, how to make a diagnosis, and also understand that what is going to be the prognosis now of this after treatment. It's very important to tell the patient in the beginning only that this is the amount of satisfaction we will be able to deliver at the end of the case.
And x-rays is both IOPs and OPGs.
Absolutely, absolutely. They're both IOPs and OPGs. Both are there in the academy, and both will be taught to you. Yeah. Then number 2, there's endo course, where endo is at this level of general dentistry. Endo is all about root canals. So if we are not going to use any high terminology here, because that's not what we are teaching. Definitely for you at general dentistry level, endo is only root canal. Oral surgery is all about extractions, but definitely impactions. We have 5 cases on impactions that, one is for observing, another 5 for performing. But after finishing your endo in general dentistry or oral surgery in general dentistry, as I already mentioned, if you want, you can top up and learn more specialized techniques if you want to. Then prostho is all about fixed prostho. As far as the general dentistry course is concerned, we're doing fixed prostho, which is crowns.
Which is the need of the eye. I mean, removable is hardly into clinical practice.
Crowns and bridges.
Yes.
Perio, we have 3-4 classes on perio. We are teaching you simple cleaning of the teeth and some level of curettage and root planning. And then there are 2-3 classes on cosmetics, where we teach you external, internal bleaching, because again, that is a need of the hour.
Yes.
And some composite fillings.
So that covers almost everything that is the bread and butter in dentistry.
There are 5 classes on ortho, in which we are going to do OPG, lateral ceph, and then cephalometric tracing. And to understand what is going to be better for this patient, either we go for fixed ortho, or we do aligners, or we do bags or straight wire, whatever. So that diagnosis will be taught to you, along with the myofunctional appliances and habit breaking appliances and everything that we can do ourselves as BDS in the clinic. But for other procedures, and we, either you do a full orthodontia course, or you can call an orthodontist.
So basically, if you start your own clinical practice with this base knowledge, you will be able to even, diagnose a case as of what intervention the specialist will do.
Absolutely.
So you will be in the same line of thinking, and portable X-rays and Zoom bleach. I think
Absolutely.
everything, all the latest
Everything.
technology is available.
Digital scans,
Yes, all the
portable
digital
X-rays,
scans, yes.
Zoom, OPG, RV, everything.
Everything.
You
Rotary
get
endodontics.
Exactly. You'll get an exposure of everything here. It's
Yeah.
not like, the old trotted
Just
ways.
the
No,
hand filing,
no,
or just
no,
the
no.
fixed IOPAs. So
Nothing.
even if you're starting your practice, you know what level you can start with. You can start from here, you can start from here, or you can start from here. So you will have a top-notch baseline to start with. So it's a beautiful course. I think it covers almost everything that a dental surgeon needs to
Yes.
start his dental practice. And then you can also jump on, if you think you have a good hands-on experience in the basics, but you need just a little extra in prostho, ortho, or endo-oral surgery, then you have these specialized courses.
Yes. And when I promote so much that the education is key to success, learning is the key to everything, it is your passport for future, I believe the same for myself also. If a student comes up and tells me, ma'am, that I would like to learn this, or this is deficit in your course, I hope you would have added this. We are open to this. We're
Yeah.
absolutely open to that. The students,
Constructive,
yeah, I
thing.
learn a lot from them.
Correct.
I really learn a lot from them. It's not that I am only teaching you. I learn so much from them, and they come up with very new ideas, which we keep inculcating in our courses.
Education is always mutual, as they say.
Yeah, it's very mutual.
So, ma'am, what about these specialist courses? Suppose a student wants to do an endodontic specialized course. Is that a long-term course, or is it a short-term, or both?
Yes. So if you join an endodontic specialized course with us, number one, the classes are more than double.
Okay.
As compared to the general dentistry. So in general dentistry, I think we have 12 endo classes. I am just giving a ballpark figure. Most of it is written in the
website. Yeah.
But just a ballpark figure, maybe the endo classes are about 12 in the general dentistry course. So if you join the main course, then it is more than 24.
Okay. In the short-term course?
Short-term course is 12.
Okay.
That
in
is
the long
general
term?
dentistry. In long term, it is 24.
Okay.
Yes, there's a short-term course on endo.
Endo also,
Again,
yes.
that is also 12.
Okay.
Right? But a long-term course is about 24 classes. So what happens is that when you do a long-term course, after 12 classes, your speed increases.
Correct.
Yeah? So you're able to do about cases a day.
in a day.
You're about to do 2 cases a day. Then single sitting becomes very easy for you because you've been doing cases.
Yeah.
RCT in 8 is also a part of this long course.
The long-term endo course. Okay.
Epicectomies is a part of the course. Post and core is a part of the course. So other aspects of endo also start coming in.
All right. So that
Yeah.
can even qualify you as a consultant in your friend's clinic. So if you've started your practice, you're expert in endodontics, maybe your colleagues from your neighborhood call you up for a case in post and core or
Absolutely,
epicectomies.
absolutely.
So that is you get an edge over your friends when it gives you a lot of confidence.
A lot of confidence. Now let's talk about oral surgery.
Yeah.
Suppose in oral surgery, if you have done a short-term course or it is a part of general dentistry, then you learn exodontia to the perfect. There's no doubt about it. Impaction, yes, you definitely get some hands-on experience. But if you do a full oral surgery course, then you will learn impactions more. You will be learning a lot of cyst managements.
Okay.
We will also be teaching you the IMF and all on the model. Because, I still encourage that I am not here to create quacks.
Correct.
What a specialist has to do in the hospital setup. So I would not encourage that you guys should start doing intermaxillary fixations in your clinic yourself. I would appreciate that an intervention of oral surgeon is important in that. Having said that, we will teach you on the model so that, the oral surgeon walks in, does the IMF, leaves the clinic. At least after that, for small things, when patient comes, you can handle.
Correct.
You should know where the wire is moving, from where do you have to
Correct.
So lot of support.
Or maybe an emergency management of the case can be done if you know the
Absolutely.
basics of a little bit of trauma.
Absolutely. So that all is covered in oral surgery. But yes, all due respects to all the MDS faculty who have studied so much and reached here, we have to give them their place. They are what they are.
That's the referral part of it.
Yeah.
But yes, you will be doing the basics to an extent that, your practice will not be hampered. And most of the times in our practice, we have the minor procedures, mucocele removals and small
you are
pathologies.
not calling up the oral surgeon, the wire has just moved from here to there, now you come. That is
you
not
can
needed.
manage that way. So the
Yeah.
patient also has a little more confidence on you.
Absolutely.
ये doctor सब कुछ संभाल लेगा. Only for the most specialized procedure, you have to
Yes.
have an external referral.
Absolutely.
All right. So, ma'am, since we are talking about oral surgery, I'm sure basic emergency management is also taught in the course, syncope and all the hyperventilation.
There is a separate course on basic emergencies also. It is definitely a part of oral surgery, but not other courses.
Okay.
So there's a separate course on basic emergencies. It's a one-day program. If anybody wants to enroll.
But during the procedure, during the classes, if a patient has
Yes. Now that is I don't know how should I put it across that is your luck or bad luck. If that thing happens, you
It's
get
good
to
luck.
learn. Yeah, you get to learn.
Because most of the emergencies in dental practice are not really life-threatening emergencies.
Yes.
They are mostly the vasovagal syncopes or the dehydrated patient just collapsing due to extreme summers. It is more about the practitioner handling the situation than about the patient's
And you know what,
comorbidities.
Himani, if I think of it, there are 15 chairs in the academy and there are 15 patients working at one
Parallelly,
working parallelly. So,
कुछ ना कुछ.
in the whole thing, in the whole course profile, I think once it will happen.
मैम डॉक्टर भी तो collapse कर सकते हैं. डॉक्टर को सिंकोप आता है कि नहीं कभी?
Students, yes.
Students को भी आता
Students do collapse many times,
Yes.
especially in the oral surgery classes.
Yes.
The assistants do collapse.
Yes.
So you will get to see that. When
Any exposure to blood is a very big stimulant to fainting, but yes, that gives you also a lot of exposure that okay, I have to stand this. I mean, you have to go beyond watching ulcers in your third year and actually watch bleeders and stop bleeders. So I think that's a very good experience, and this happens, I'm sure, when there is a 15 or 20 chair set up and so many patients, even the waiting area patient can collapse, a patient sitting there. Plus, it is not just about a patient who has had an emergency. जब आप अपनी practice में, when you come into your practice and you see that I have to extract a patient who is diabetic, who is hypertensive, who is taking EcoSprint for blood thinner, so I mean, you will not be scared, oh, I'm not going to touch this patient.
The history
you will
part
know.
is,
Your
the
medical
history is very important.
Yes.
And case discussion. So we've made this a rule that suppose some emergency or something different has happened at one chair. So we tell everybody to stop their work for 10 minutes and come to that particular chair and understand that, because if it is new and we are teaching one person, it's better
Everybody
to teach
should learn.
everybody.
Yes.
So you will actually come along a lot of things that you would have not even expected, and that is not a part of curriculum. It is not written anywhere. Actually, our life is not written anywhere. So that's how our classes are also. So we are there to handle emergencies, and you will learn a lot which is not even written in the curriculum.
Yeah. So medical history is important. That is why the short theory discussion that happens before the practical hands-on is very important. So what to expect, what to ask the patient, and how much post-operative discomfort or post-operative जो भी sequelae रहेंगे. So that is important when you discuss these things practically, not on the textbooks, not on the exam papers, but actually with the patient.
Emotional bonding with the patient is also very important. I understand we don't have to get very emotional, but still a little bonding is very important, and that is what you will learn when you will see the patients there practically.
Correct. How the patient can, build a trust on you, which is the most important aspect. So this is about oral surgery mainly, ma'am. So a little bit of pathology here and there and trauma on models. Okay, what about the prosthodontics long course, ma'am?
So prosthodontic long course, we have also included dentures in that, because
dentures.
Still there are students who join us from the towns around, or small towns,
tier 2, tier 3 cities,
in
smaller
India,
towns,
and their dentures are very popular. Implants have not become a very big thing yet, and so there are a lot of students who come and ask us for and believe me, complete denture till today is a challenge for every practitioner. It's a nightmare for every practitioner. I know.
Correct.
So we have included complete dentures, RPDs, chromium cobalt dentures. So all kind of removable aspect has been added to that. And of course then, there is the fixed prosthodontia in different
the
ways.
long-term program also. So
yeah.
your tuning with the dental laboratory comes to be very important here. You have to give instructions to the lab depending on the case, and this is where you learn, how to communicate with the lab, how to, what instructions you need to give.
That for both. That for the small course, long course, fixed prostho, complete
General
dentures.
dentistry.
You have to the lab guy is going to be there. He's we have provided that from our end, but giving instructions to him, getting your thing done is totally your responsibility.
Yes.
And I think you should do it. It's very
course.
important. Yeah.
Because here you have a setup, or maybe if you send it to a very big lab which has all the staff and they know how to make, convert dentures, how to do teeth setting, it's very good. But maybe if you're not in a very big town, or maybe in a place where the lab facility is not very great, maybe you have to help the technician set up a very good lab. And,
but Himani, I'm sorry I would like to correct you on this. Even in the largest of labs and the most fancy labs that we are sending our work to, every evening 1 hour I'm just giving them instructions.
Correct.
And still, they can make mistakes. We're all humans. We are also making mistakes. They are also, because they have never worked on flesh. They've never worked on humans. For them, everybody is a stone.
Model. It's a model.
So, it's a lot of difference. They would not really understand what you can understand. So you have to spend 1 hour in the evening every day with the lab, and that's how you would actually reach perfection.
Correct. So synchronization with the lab, synchronization with your assistant who is assisting you in taking impressions or in a surgery, synchronization with your friends so that whenever you are in need, they are there to help you. I think synchronization with the mentors is also very important, and you have a lot of support to the students who finish the course and go back, especially in your ortho cases, I guess.
So, our ortho course is very beautifully planned, Himani, because in ortho, we finished teaching in 3 months. You've come, discussed the case, we've bonded the brackets on the patient. Now, the first stage is over. Now, what are we doing? We're just sitting and waiting, for every 21 days for the patient to come back. So, we have a very beautiful program. It is a 1-year program wherein you stay with us for about 2 to 3 months. You finish your initial phase, and then you can come back to us every 1 month, or 21 days or 40 days depending upon your schedule. We are here. There are other students who are there to support your patients. You will not be given a call for every small thing. But you would see every stage of the patient treatment, and you will finish the braces yourself, debond the patient, do a proper cleaning, polishing, give them proper retainers yourself. So that whole procedure would take about an year. So we are connected to you for entire 1 year, and you will learn every stage of orthodontia yourself. So it is a very, very nicely and beautifully programmed. But sometimes the student says that I will only do a 3-month program and then I want to go. But can you help me online? So we keep guiding them online on all the cases that they have started there. So our mentors go online every 21 days or a month, and they see their cases and help them how to pursue. So that bonding, that relationship, that education program goes on for entire year. But there are certain students who don't want that support because of many reasons, and they say, no, we are only going to do a short-term course, finish till the stage 1, and then we will manage ourselves. There are people in our city, there are people in our state where, they can come and help us. Fair enough. Then we have a short program. So you can choose for yourself.
Okay. That's very nice. So this is all about all the basic programs.
Yes.
And some people are already practitioners. Some people are already practicing. They've finished even some have finished their post-graduation. I mean, I had my juniors from AIMS also who had completed their prosthodontics or endodontics, but they want a little exposure in other fields so that, they can, when they start a clinic, it's not कि भाई भूल गए हैं थोड़ा बहुत oral surgery.
So in the batch of about 12 students, when we say we have 15 chairs, we make a batch of 12 students.
Okay.
Because, sometimes I don't like that one chair is not working, the student is standing. Sometimes there has been an emergency, so one chair has been used for a longer time. So if we have a batch of 12 students, out of them you will see 2 or 3 have already done their MDS in one particular field, and they've come for something else. Not to point out anything, but I've had students who are doing endo in various, especially for endo, who are doing endo.
PG in endo.
PG in endo, yes. They're doing PG in endo in the colleges around Delhi, but they're not able to learn much because of the patient exposure.
Dearth of patients. So they come and join these courses so that they can perform better in their colleges. So it's also for the clinicians. Yes. It's also to upgrade we have implant courses, we have special cosmetic dentistry
Yes,
courses. So most of the clinicians usually like to, upgrade their practice and learn implant dentistry with us.
Yes. So, implant, as you all know, is a very, very specialized procedure, and we have a group of doctors who are handling implants. This implant course, we have oral surgeons, we have implantologists, and we also have the prosthodontists. So, they, as a combination, are taking up this course. It's very specialized, and besides being specialized, it's a very short and crisp course. We're not wasting time. We have a 5-day oral surgery program, which is a full-day program, in which we are teaching you everything which is surgery related and implant placement. And then we like to give a 3-month break so that those implants get ossified and you are able to do prostho on the same patient. So then there's a different level of satisfaction when you are doing it on the same patient and you see your own patient, own work commencing.
Correct.
Having said that, if you are not from Delhi or maybe not from India, I get a lot of students from other countries,
outside
right?
India,
Now, they are only in India for 10 days. I don't expect them to come back again to do a prostho part. So, we'll probably keep 1 or 2 immediate loading cases in your particular curriculum. And we have cases where we've already placed implants and they are ossified, and we will give those cases to you. In such a situation, for the prostho part. In such a situation, we can be short of 1 or 2 cases. I'm being very honest because I'm talking to all of you, and I think every relationship is built on honesty. Suppose you placed 5 implants, I might not be able to give you 5 prostho, but at least we'll give you 4.
Okay. And that is only when you want it immediately. You want to finish the things immediately.
Absolutely. That's only when you want to finish it immediately. That's the only difference we might have.
Yeah. And beautiful hostel facilities available for all those who are not staying in Delhi, who are coming from other parts of the country. So many hostel facilities available just across the center where you can learn. I think all kinds of hostel facilities, food facilities, no problems with anything of that sort.
Anything. It's as you see, our address is Vasant Vihar. So Vasant Vihar is the hub of Delhi. Everybody knows it's like center, right? Having said that, it is also a very expensive area. So if you were looking for an accommodation which is like 30 seconds walk from the academy, we have it. If you're looking for a budgeted accommodation which is 5 minutes from the academy, we have it. So you ask the thing and we are there to help you.
All right. So staying is not an issue. Eating is not an issue. Now you know about the courses. A cosmetic dentist
patient is not the issue.
Patient is not an issue. Definitely
that is what everybody is coming for.
Yeah. So there is no dearth to patients. So the cosmetic dentistry course के बारे में आप बता रहे थे. What are the inclusions? मतलब क्या
सीखेगा? So cosmetic course is a very fast selling course because now it is an era of cosmetics. Anything starting from a simple procedure of lightening the tooth structure, making them a little brighter, to getting laminates, which is like one of the major procedures in cosmetics.
Correct.
We are, everybody wants to look nice. I am not advocating that, because I like to. Natural is always better, but still, when people want it, you have to give it. So, we do external, internal bleaching. We do smile designing. When we are doing smile designing, we also keep account of small things like shade matching.
Correct.
So many times we do a beautiful procedure, but because of the shade, we fail.
Correct.
So starting from shade matching to smile designing to laminates, veneers, composite laminates, as well as ceramic laminates, everything is included in this. But we have to understand the fact that we are a dental academy. So we are not touching on any skin aspect.
Of course.
It's totally cosmetics.
Dental cosmetics.
It's totally dental cosmetics. And we are going to teach you everything that comes under dental cosmetics. It can be as small as like placing a tooth jewelry.
Yeah.
So everything is included.
Wow, sounds excellent, ma'am.
And in our, sorry to interrupt, in our cosmetic thing, there's also a little part on orthodontia, because orthodontics plays a very important role in cosmetics, and in the past, I think that was the only option.
Yeah.
So we have a small part of orthodontics.
Single tooth movements and all those things. Yeah.
Exactly.
Very nice. So I think most of the doubts that what is there about the different courses, that should be clear now. And one thing I was curious about, ma'am, that जो बच्चे BDS कर रहे हैं उनके लिए तो all these courses make sense, या जो internship कर रहे हैं या जो post graduation भी कर रहे हैं, but so many clinicians I have seen coming and doing our courses What about the, matlab, which is the eldest patients or the eldest students that come to you?
You know, Himani, you will be shocked that, and I'm very proud of saying this, that we have given profession back to so many women.
Oh, really?
It's not about age at all. I'll
Correct.
talk about I know the question was more about clinicians. I'll come back to that. I'll definitely answer. But so many women who had left dentistry post-marriage,
Correct.
post-children,
And
for various reasons. I have a huge list, and I'm so proud that, you know, we've given profession back to them. So
Wow.
I often tell this, you know, that everybody's not as lucky to get married in a family who supports
the work,
the work of a woman.
Correct.
We are one of them, but that doesn't mean that we don't understand the agony on the other side.
Correct. Very true.
Age is not the criteria. Please, if for some reasons you have not been practicing dentistry for a while, please come back to us. You are still a doctor, and they say once you learn swimming, you don't forget. Once you learn driving, you don't forget. Similarly, once you're a doctor for life. You don't forget. Come back to us. We're just going to push you a little bit. Just a little push, and you will be there. You will rock it. Coming to the question, the clinicians.
Yeah.
Every day is a learning procedure, you know. I mean, there's so many things that I need to learn, and I'm sure, Himani, there'll be so many things that you want to
100%.
learn. Please,
100%.
please do come to us. Age is not the criteria.
Yeah.
If we have, again, coming back to if the batch size is 12, yes, you would find that about 6 to 8 students are the young graduates, but the rest, 4 to 5, definitely between the age of 30 to 50, you'll find many.
Oh.
Yes, many between the age of 30 to... I'm 47, I'm ready to learn.
Okay, that's very nice. So,
yeah.
Age is not a bar. It's not just for the interns or the post-interns or the postgraduates. It's also for anybody and everybody who is keen on learning, who wants to upgrade, who wants to get better on their practice, or has had a break in work because of maternity or marriage. Also, very importantly, the third years, the second year BDS, all the students who might have next coming up. Yeah. So we all know about next. So next is going to be the national exit exam, and it has already been announced in the medical, in the MBBS segment, and very soon it's going to be announced in the dental segment also. So instead of just an entrance exam based on MCQs, it's going to be an exit exam in your final years that will have theory as well as an assessment of your clinical skills. So you would want that, you know, with the finishing of your internship, your clinical skills are, you know, good enough to, you know, pass you out through the next and make you eligible for a postgraduate course in India at least. So anybody and everybody who is in your first year, second year, third years of BDS and wants that, you know, from the beginning only, let me have a good hands-on on patients, let me have good clinical skills, because next is coming up. The CEP is for all of you. Okay, you can come to Delhi for a 2 months vacation and do 33 classes of endo or a few classes of oral surgery, few classes of prostho, depending on what is your interest or what is the lacuna that you find in your, you know, in your practice, in your college.
So initially we were very adamant about the fact, Himani, that the only students who can join us are the ones who have their final year passing certificate.
Okay.
That was very clear, because I didn't want, as I
experiment
said, I don't want you know, people to come and experiment, number one. Number two, I didn't want that people take a disadvantage of this whole thing. People take advantage of this whole thing of, you know, that we go and learn in the academy and then don't pursue their degrees and all that. I wanted people to, you know, the ones who are actually doctors to come and learn, but now we've opened to the other students who are dental students and who need a little briefing in their clinical
practice. Because third is the time when you start your clinical postings. If there is a dearth of patients, if you feel the hands-on is not enough for you to learn the skills, the CP program is opening their doors for all of you. So you can come in your vacations, you can come in your free days, learn, do a 10-day, 12-day program, 10 classes.
Absolutely, we can custom make for you, and we are going to come up with the next program
very soon.
As
soon as it is
as soon as we join
officially announced.
Yeah, together we will with DBMCI, we will you know, start a next program, and then we'll announce when it is has to be announced.
Yeah. So, I think that is it, ma'am.
Yes. I think we've... for anything, you can obviously get in touch with us.
Yeah. So all those who want to enroll into any of these long or short-term programs, or you have any queries, you have the website link. You can just go log on to the website, read all the inclusions of the different programs, short-term courses, long-term courses, basic courses, specialized courses, and you can enroll through the website directly. All right. So this is us signing off. Thank you so much, ma'am, for
Such a pleasure.
coming
Such a
over
pleasure.
and clearing the doubts for the students. And yeah, stay in touch, get upgraded in your practice, and do well. Do well for the patients, do well for yourselves.
Yeah, great.
Good
Thank
day.
you so much. Thank
Okay.
you.